Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the different types of nerve fibers. We're going to go a little bit more technical today and give you a little bit more information probably than is typical, but it's important that you understand this because it's going to give you a little bit more information about your peripheral neuropathy. There are 4 different types of axon types for sensory nerves. You have the A alpha, the A beta, A delta, and the C fibers. All of these fibers vary in size, going from the A alpha being the largest at 13 to 20 micrometers, A beta being 6 to 12 micrometers, A delta being 1 to 5, and the C fibers being 0.2 to 1.5. The myelinated fibers are the A alpha, A beta, and A delta, and the C fibers, of course, are unmyelinated. So that being said, the larger the fiber, the quicker that the signals are carried, the quicker that they flow. Some additional information: the A alpha nerves carry information related to proprioception, so kind of muscle sense. There'll be the pressure sensation and proprioception, feeling, basically being able to tell your location and the pressure in that area. A beta nerve fibers give the information related to touch. The A delta fibers are primarily related to pain and temperature, and the C nerve fibers are related to pain, temperature, and itch. So that gives you a little bit of information about those. It may give you a little bit of information also about what to expect or what to think about in those particular areas, right? So with that information being said, you also need to understand a little bit about where these fibers could be located or where they will be found. So if you have a small fiber sensory neuropathy, then you're going to primarily have the smallest fibers, the A delta and the unmyelinated C fibers for small fiber peripheral neuropathy. And so these fibers will, of course, provide the functions of the small fiber neuropathy as well as the autonomic neuropathy or the automatic functions of the body. So that's those fibers, which tells you that the other two, the A alpha and A beta, are the primary nerves for the large fiber neuropathy or large fiber nerves. So when you start looking at the different sensations, the different ways that small fibers and large fiber are going to present, that gives you a little bit of information. So now if you want to go to the next piece of the puzzle, you've also got motor nerves, right? The motor nerves are split also into 2 types: the alpha motor neurons and the gamma motor neurons. The alpha motor neurons do the extrafusal fibers, or the fibers that cause contraction of the muscle, and the gamma motor neurons, called the intrafusal fibers, are the ones that prevent or react to stretch. So now that you understand kind of the basics, we're going to change the nomenclature a little bit more, because the newer information, the newer studies are now showing a little bit of a change in the nomenclature. They're moving away from the alpha and C fiber and giving them instead numbers. So you actually have proprioception or position sense is received by the 1A fibers, which are the A alpha fibers, and the 1B fibers, which are the A alpha fibers as well. So you've now got 2 types that when you break up the A alpha fibers into the 1A, which control the muscle spindle, and the 1B, which is the Golgi tendon organ. So they're actually focusing more on the tendons themselves. The nerve fiber 2 are the A beta, which are touch and pressure sensory fibers. So with that being said, as you remember, the A alpha and the A beta are the large fiber nerves. So that's the 1A, 1B, and 2 are the large fiber sensory nerves. A delta has some designation in the 2 and 3. So 2 and 3 are both A delta, which makes them small fiber neuropathy. 3 and 4 can also be the C fibers. So how do you know if it's a 3 or a 4? It's based on what its temperature. So 2 and 3 are cold sensation, 3 and 4 are heat sensation. So 3 does both cold and hot, whereas 4 does just the hot. Again, as we're doing examinations, you're actually saying these are the different types of nerves and so forth that are happening. So if that's not confusing, then let me take a step back and try to simplify it just a second for you. As you remember, there's 2 types of motor nerves, and the motor nerves are the alpha motor nerves and the gamma motor nerves. And so that's one type. So you can actually forget about those for now. If with the motor neuropathy, it's going to be those 2 types of nerves. For the small fiber neuropathy, you're going to have the C fibers and the A delta fibers, which are 3 and 4. You do have some 2, but those are not as common. And most of the time 2 is going to be related to a large fiber neuropathy, including the A beta and A alpha fibers. And then 1A and 1B are also part of this large fiber neuropathy. So large fiber neuropathy, A alpha or 1A and 1B. The A beta or 2 are large fiber neuropathy. Small fiber neuropathy are the A delta, which are 2 and 3, and the C fibers, which are 3 and 4. Okay. So now that you know the basics, you'll be able to read the studies a little bit better. But the truth is, the most important is, do you have a small fiber neuropathy or a large fiber neuropathy, a motor neuropathy or an autonomic neuropathy? This is Dr. Brandt Gibson, and this was a little bit more complicated Neuropathy Nugget, day 123, I believe. Yep, 123.